exactly what's bothering you. Can you go through that for me?
You might have to back up that way so you can see both of this. Okay. The first attack was like when I was like 17. Somehow I just started having my first muscle spasm where I went into the neck brace. They thought I was faking it, but they put me in a neck brace after running to the hospital.
Sure.
And then I started having a muscle spasm where it was, the pain would hit the neck, and I'd have to be put in a neck brace and taken home with Vicodin medication.
So mostly neck.
Neck, yeah, neck, yep. Now it's at a point to where I'm getting tinglings and weird muscle movements, uncontrollable muscle movements. I got a constant headache. Yep, constantly. Very painful to get out of bed. Sometimes I have to roll out of bed. Sometimes it feels like I have to have, or sometimes I feel like I'm going to go through another muscle spasm. Like right now, just sitting here, I feel the pain going down the right shoulder, left shoulder, going underneath the left shoulder into the arm.
Does it affect how you walk?
Sometimes, yeah, my balance is getting worse. I seem to trip over things that are like this small. I get dizzy spells a lot, out of spite. When I tilt my head back like this, that's where I start to feel the pain. Me thinking before I even knew that it was this bad, I would just go a little further, and then it would just pop, boom.
Okay.
So I have a lot of popping issues when I move my neck. Sometimes it happens just out of arm movement. I get the pain. I like move my arm. Right now, because I did that, I feel the pain going from like here down to about here.
Okay.
And it's like right down the center, like exactly down the center. But just sitting like this, like right here, I feel the pain underneath the shoulder. Like it needs to be massaged out, but it can't be.
Can you sit there for me?
Yeah.
Where do you live?
I live with a roommate.
I mean in town, or do you live?
Yeah. Took a couple of times, but it was funny.
I'm going to move your feet, just kind of let them dangle.
Do you want me to take the shoes off?
No, you can keep them on for now.
I feel some tingling in the toe, and the big toe. It's weird. Good.
They're good. They may be a little too good. We'll go with that in a minute. Can you go like this with your arms? Don't let me push down.
Yeah.
Not like this. Don't let me pull. Are you right-handed?
I'm ambidextrous.
Don't let me pull. Push against me. Push against me. A little bit of weakness there, not too much, just a little bit different. Like this. Don't let me push down. Don't let me push down. Good. Okay. Let me go over your MRI with you and kind of show you why.
Can I sit there?
Sure, wherever's comfortable.
I just want to be able to see the screen.
Now this is looking at your spine from the side. So this is
weird.
This is going to be your face here. This is going to be the skin on the front of the neck. This is going to be the skin on the back of the neck. This is going to be the bottom part of your brain, and then it turns into the spinal cord. Spinal cord is where all your nerves go through to get to your body.
What's this?
I'll go over everything. I just want to kind of go over so you can have an understanding when I go over what's wrong. So you have the spinal cord here, and then the white in front of it and behind it is fluid that surrounds the spinal cord. So you have a little bit of fluid that surrounds it. We don't know what all the functions of it are, but it does circulate through, and it does provide a little bit of cushion. So things aren't touching it. This is the second bone in the neck. It's a funny shaped bone, and the rest of them are shaped like squares. And then you have a disc between the bones. And these discs here and all these discs are normal appearing discs. Here you can see how they don't look the same. They're darker and they don't have a good outline to them. You see the white in the bones? That's edema. It's a fluid buildup. It's degenerative in nature, which means it could be from old injuries or wear and tear, but it's a fluid in the bone, and it could be an indication there's a little bit of looseness there or some damage to the bone. And then you can see here how this is the bone, so it's kind of spurred out here, so it's not a straight line like it is up here. And then the disc is bulging out here. And the same thing here. And you can see how you don't have the fluid in front of that area anymore. And if we go off to the left side, you can see it's worsened here. And you can make out in the spinal cord how there's a little bit of change in the color to the spinal cord. Not a lot, but a little bit. Now, that's a sign that at some point that got damaged. It could have been with a fall that you've had.
Wrestling.
Could have been wrestling, it could have been a fall. Or just from wear and tear moving the spinal cord beginning up, and it could be enough where it bruises it. So it doesn't...
Does it explain why when I move my head certain ways it locks up and stops? Don't want to go no further?
This won't explain it, but because the joint's damaged, that's a common thing where the whole joint's damaged, so it doesn't have the normal fluid and normal mobility. Now, when you were saying, if we look here, and the nerves come out through a small hole on the side, so when you bend backwards, the hole gets smaller, so that's why when you bend backwards, you get more symptoms than you do if you bend forward, where they open up.
Absolutely.
So, for something like this, some of your symptoms could be explained by this, not all of them. This shouldn't give you a dizziness. It shouldn't cause any symptoms into the face or things like that. So, but it very likely could be explaining some of the neck pain, some of the headaches that you're having, and
all the time,
and the left arm symptoms, the tingling, the numbness, and the pain that you're having. Now, headaches are somewhat of a wild card. Sometimes they have nothing to do with this. Other times you get it fixed and the headaches go away. It's extremely hard to predict. So we never do surgery for headaches because it's so erratic. However, in your particular situation, you have other sort of problems. It's not just headaches that we would consider fixing this. The main problem that we see is that your spinal cord is being pinched. And it's being pinched, and it's being put pressure on it.
And the nerve?
The whole spinal cord. So it's more than a nerve. The whole spinal cord is being pinched, being compressed. And we see it being damaged. There's a bruise in it. So we know that if this is left alone, that this is very likely to worsen.
I don't want it to be left alone. I want it fixed.
Now, it's not necessarily mean that it'll be worse tomorrow or next month, but a year from now, 5 years from now, very likely this will be worse than it is now. And a young person, there's no reason not to fix this.
I'd rather have it fixed now than before I get old,
I that's what I'm saying.
I got the immune system.
Now, when we have a neck problem, most of us, have things that don't need surgery. Most of us get better with time. This particular condition likely will get worse, or stay the same, which is a problem when the spinal cord is being pinched.
Now, is that the juice? This bulge right there that goes into the nerve?
What's going into the nerve, you got bone spurs and disc bulging or herniations into it.
So you have to use a machine to take the spurs out?
What we would do, we all probably do it a little bit different, but somewhat similar. We make a small incision in the front of the neck. We come here, we remove the disc, and we, a combination of small instruments to remove the disc. But we have to get above it and below it, so we have to remove some of that bone. So we use a high-speed drill that will drill down the bone to a thin layer of it remains. We don't want to drill all the way through, so we drill to a thin layer, and then we have micro instruments that remove the remainder of the bone and the disc when we get close to the nerves, because we don't want the vibration damaging the nerves. And then in that place we put a small polymer cage with bone inside of it. I use cadaver bone from...
Like with the screws and stuff?
Well, the cage doesn't have screws, the bone doesn't have screws, but then we do put a plate that has screws in it.
Yeah, I saw that on YouTube. How they
So
did that.
we would fix both of these areas. This is your worst area, but they both have a problem.
Yeah.
Surgery takes about an hour and a half. We keep you in the hospital overnight, and the reason we keep you there is so you're not having too much pain, but also if there's any swelling or bleeding in the neck, we would be able to take care of it easier than if you were home. It's unusual for something like that to happen, but
So I'm requiring surgery?
I would recommend surgery, yes.
Me too, because I don't want to what do you say, be in a wheelchair at like 50.
And that would be a possibility with this, with the spinal cord being pinched. Now, the goal of the surgery is to take the pressure out of the spinal cord so that doesn't happen.
Anything to get rid of the pain, anything.
You would have a reasonable chance of helping with some of the pain. Headaches, like we said, it may not help with headaches at all. Symptoms up higher, unlikely to help. We're hoping it would help with the arm pain, and with time, we get the weakness back to normal, hopefully, and the numbness back to normal. But some of that is likely to remain because there is a bruise in the nerves. It's a sign that they've been damaged. So some of these things will remain because of that damage. But if it's left alone, that damage will worsen likely, and we want to prevent things from worsening.
That's really a lot. So that's really located in between because I can feel the spinal cord. How come that's out?
You can't feel your spinal cord.
Like the bones right here.
You can feel the bone. And you can kind of make out here. This is the bottom of your face here.
That's the real part.
And this is your Adam's apple right here. So you can see it's going to be right. The main part of that is right below that. So yours is going to be right there. The incision is
You'll put me to sleep, right?
You'll be completely asleep.
Okay, good. I don't want to
So typically with this sort of surgery, again, our main goal is to prevent this from worsening. We would expect some of your symptoms to get better, not all the way better, and some of them not to get better, and the headaches we're not certain about. So I would estimate maybe about a 70% chance that you will feel better after surgery, after you recover. And if successful, we will prevent this from being a problem in the future, which we know it will be. Now, you have other discs in your neck, other discs in other parts of your body, which may give you trouble in the future. This surgery is really not addressing that. It's just to address these two areas.
That's the worst of it, yeah.
Exactly.
Now, will this affect future movement? Will I learn how to relearn how to
Good question.
Like where I'll be able to play softball, do taekwondo?
Very likely you'd be able to do those things. Now, taekwondo, you're going to need an extended period after surgery to be able to do it. A good person, to be able to compare this to is Peyton Manning. He's a professional quarterback. He had a surgery like this. We're not sure how many levels he had. We guess he had one, but quite possibly could have more than one.
They do a lot of damage.
Yeah, he missed a year out from football, which any sort of real contact, you're going to have to be looking about a year before you're going back to do those sort of things. But these discs aren't moving normally now, so very likely you may not notice a big difference in your mobility after surgery.
So should I have played softball this year, should I cancel my...
Mine is softball.
It starts on the...
6th.
Yeah, it starts on the 6th of the first game.
6th of what month?
This month, May.
Yeah, you won't be able to play.
No, that was
At least 30 months of not doing anything like
and
that.
that's about the length, so I'm going to have somebody to replace. I got somebody to replace me just in case, so I'm willing to deal with that as long as this goes away, because when I move my head back, and then when I move slowly and the pain slowly starts to go away, I get lightheaded and dizziness. And no good.
Is there a particular time you want to get this done?
Anytime, as soon as possible.
Do you smoke?
Not anymore.
Good. For how long have you not smoked?
2 weeks.
Keep it off, because smoking is going to increase your risk of not healing properly.
Yeah, I quit smoking and drinking.
With the smoking, you have even though you quit smoking, you have a likely a little bit higher chance of it not healing properly, because it takes a while to get out of your system. But not smoking while this is healing is going to be a great benefit, so keep that up.
Well, I was smoking. I used to smoke years ago about 2 packs a day, and now I went for a year, maybe a half a pack a day, maybe not less, maybe less.
Any questions that you have that I didn't answer?
No, you pretty much nailed it. When do they want to start that? As soon as possible, the better.
Right. I'll have my nurse come in, and she'll talk to you. And for this sort of surgery, it doesn't take very long. We won't have to have you wait. With our schedule, I'm sure we'd be able to do it as early as next week if you would like to do it that soon. If that's too soon, we'll do it whenever you want.
As soon as possible.
All right. I'll have them come in, and we'll work on trying to get something set up for next week.
Okay.
It's a pleasure to meet you.
You too. Thank you.
You're welcome.
Thank you.
You're welcome.
You look by the way, you look different in the pictures.
Yeah, you probably took that about 10 years ago, I would guess. It's hard to know.
You're thinner.
Yeah.
Thanks.